This is the typical thoracic vertebra. Heart-shaped body lies anteriorly and its anteroposterior diameter and transverse diameter are almost equal. Body presents two costal demifacets on each side. Transverse process is large and cleft-shaped and projects laterally from the junction of the pedicle and lamina. Vertebral foramen is small and circular. Spinous process is long and is directed backward and downward. In our body, 2nd to 8th thoracic vertebra are typical because they bear common features. First and 9 to 12 vertebra, 9 to 12 thoracic vertebra are atypical because they have distinguishing characteristics. This is the first thoracic atypical vertebra. Its heart-shaped body lies anteriorly and the transverse diameter is almost twice the anteroposterior diameter. Body present two costal demifacet. Upper demifacet is circular and lower demifacet is small and semilunar. Spinous process is thick, long and horizontal, which lies posteriorly. This is the 9 atypical thoracic vertebra. It possesses an upper demifacet on each side of the body. Lower demifacet is missing. Other features are similar to the typical vertebra. This is the 10th thoracic atypical vertebra. It possesses a single full costal facet on each side of the body. It has costal facet on its transverse process also. Its body is large and assumes the shape of the lumbar type. This is the 11th thoracic atypical vertebra. It presents single full costal facet on each side of the body. Transverse process do not bear any costal facet. The inferior articular facets are flat and faces forward and medially. This is the 12th atypical thoracic vertebra. It has also single full costal facet on each side of the body. This is spinous process, which is nearly horizontal, and its inferior articular facet projects forward and medially. Its transverse process is devoid of costal facet because the 12th rib is also floating. Transverse process is small and it presents a tubercle, superior tubercle, lateral tubercle and inferior tubercle. Superior tubercle represents the mammillary tubercle of the lumbar vertebra. Inferior tubercle represents the accessory tubercle of the lumbar vertebra, and the lateral tubercle represents the true transverse process.